the mic back to Paul.
Sorry, unable to click buttons and use my brain at the same time. Thank you so much, Carolyn, for getting us started and talking through those things. I also want to say, if anyone has questions about what's confidential, what's not confidential, what's recorded, what's not recorded, please feel free to use the chat. Adam is going to be monitoring that throughout. So even if one of us is presenting, Adam will make sure that any of your questions or concerns are attended to. So for those who've joined us in the last 5 minutes, I'll introduce myself again. My name is Molly Quinn. I serve as Executive Director of OUTMemphis. OUTMemphis is the LGBTQ plus community center based in Memphis. We serve the Mid-South, and we are very proud to be the largest social service provider in Tennessee. So we focus a lot on the full spectrum of needs of LGBTQ people. And it's really our pleasure to have you all here today. I know that this moment and the topics that we are going to dive into tonight are really serious, but I also want to make sure that we can all be comfortable and casual and have our own moments of levity tonight in this discussion. It's our pleasure to have you. Before we sort of dive in, I'm going to talk a little bit later this evening about what my organization offers. I wanted to address for all that the folks who are presenting to you tonight have been working in really close collaboration over the last 8 months, some of us the last 6 months, to prepare for this moment. So while the reality of SB1 going into effect is something we had hoped would not happen, we have been hustling and have a lot to share, a lot of plans in the pipeline, not just in Tennessee, but across the country, folks that are ready to take care of you and your patients or the folks that you look after. All right, so without any further ado, and I will share a little bit more about OUTMemphis later, our presenters for the evening are each going to share a little bit of information about what's going on based on the expertise that each of us have for the kind of work that we do here in Tennessee. So for each of my presenters, I'm going to pass off to, I'm going to ask you to share your name, your pronouns, the organization that you work with and what you do there, and also where you're based out of. So we are going to get started tonight with the dirty details, the legal stuff. So I'm going to pass over to my very good friend, Lucas Cameron Vaughn with the ACLU of Tennessee.
Hey, thanks, Molly. Hi, everyone. My name is Lucas Cameron Vaughn. I use he, him pronouns, and I'm an attorney at the ACLU of Tennessee. And I'm one of the attorneys working on the legal team for the challenge to Tennessee's healthcare ban called LW versus Scrimeti.
Okay, awesome. So Lucas, can you tell us a little bit about, the status of litigation? If you can sort of explain to us a little bit about what you tried to explain it to me last weekend, and all the law school that I didn't go to wasn't helpful, but where we exactly are in the process of litigation and what that kind of means, to sort of give people like a little bit of context. And what's in effect, what's not in effect, what kind of timeline we might be looking at.
Sure. So right now, we're, it's in a complicated posture right now. But what has happened was, on March 2nd is when Bill Lee signed the healthcare ban into law. We then filed a legal challenge against it. And at the end of June, right before July 1st, when it was supposed to take effect, a federal judge issued an order that blocked the law from taking effect while we continued our legal challenge. And when an order like that is issued by a judge, both, the opposing party has the option to seek appeal from the Court of Appeals. And that's what they did here. They filed an emergency stay request to pause the federal trial judge's order. So essentially on July 8th, unfortunately, a panel of 3 judges from the Sixth Circuit Court of Appeals in a split decision paused the the trial judge's court order that was blocking the law from going into effect. And so what that means is the Tennessee law went into effect on July 8th when the Court of Appeals issued their decision. And this is all a preliminary situation. And so what they're doing is the Court of Appeals said that they were going to expedite review of the appeal, which they plan to issue a decision by September 30th. And their decision could either uphold the judge's order blocking the law, or it could overturn the judge's order blocking the law. And right now we're on a briefing schedule. We have our briefing is due August 10th. And then there will be oral arguments, and then the Court of Appeals will make a decision. So essentially that's where we are right now.
Awesome. And Lucas, I want to thank you for your courage and your hard work with the litigation, what you've done so far for our community. Could you also explain just a little bit in detail, because I already know that this is one of the questions that folks will have, a little bit about this March 2024 extension period and what that means for care?
Yeah, so the law as written allows for the continuation of care if the patient was already receiving care as of July 1st, and they can continue to receive that same care until March 30th, 2024, at which time none of the healthcare providers in Tennessee would be able to continue that care for them. And so they would have to seek care elsewhere, or else lose access to care.
Okay, great. Yeah, thank you so much for that. Lucas, is there any other updates or just information about litigation or about the law that you want to share here at the jump, or anyone else?
I just want to say this, we are still really early in this fight, and it's far from over. And we at the ACLU won't stop defending these rights until every trans person can access the healthcare they need to be themselves. And so we've had, a little bit of a setback, but we're going to keep fighting.
Yeah, so I see one question, some questions in the chat. So we're gonna, Adam is gonna be grabbing those questions as you get posted. And then after each of our presenters have a chance to share a little bit of info, we're gonna pivot over to your question. So if you're putting something into the chat and we don't jump on your question right away, know that we either will come back to it or make sure that it's answered after the call. But just to kind of conclude that sort of the piece about where the law is, based on how things stand now, if you are already in care and you are a minor, the care that you're currently receiving in state, you can continue to receive through March 2024. But that if you are not in care and seeking to be a minor, that is not available to you now. Lucas, is that correct, the way I phrased that?
Yes.
Okay. Okay, cool. So we'll jump in. So again, as I said, please feel free to keep dropping your questions, and don't feel anxious if those answers we're not getting to those answers right away. I do want to definitely emphasize that I know there are a ton of questions, and each individual care plan is really, really unique, and each individual patient deserves more than a 1 hour Zoom call to go over. So please know that we won't answer every question or hit every concern or strategize every kink in this complex situation tonight. What we wanted to do tonight is get everyone together as soon as possible after this new decision, make sure that folks have updated information about what each of us do and how to access it. But tonight's town hall is just first of many of resources and information that's going to come out to all of you. So please don't, I certainly don't want anyone to feel discouraged if the stuff they're confused about isn't resolved by 8 o'clock tonight. Okay. Thanks for that momentary digression. And then I'm going to pass back over to Carolyn, who's going to tell us a little bit about CSC's amazing programs.
Hi, everyone. Again, my name is Carolyn Jones. I use she, her pronouns, and I work on the Southern Trans Youth Emergency Project for the Campaign for Southern Equality, which is based in Asheville, North Carolina. The Southern Trans Youth Emergency Project, affectionately known as STIEP, is a program that exists in states across the South where bans and restrictions are being passed on gender-affirming care for youth and for adults in states where that is happening as well. There are kind of a few different prongs to this, but the relevant ones are we offer patient navigation to support to families who need to access care out of state. So you can reach out and we can help direct you to the clinic that is closest to you. We also provide $500 grants to help cover costs and continuing care for families in that situation. There are a couple of more general things that I want to note, but for all of your specific concerns, as Molly mentioned, I would love to set up a conversation with you. If you have specific one-on-one questions, Adam just dropped that link in the chat. Reach out to us at southernequality.org/TN resources, and we will get back to you as quickly as possible and schedule a call to talk about your situation and how we can be helpful in getting you into care in as close of a location as we can, and as soon as we can. The first thing I want to note is just that not all providers in Tennessee are continuing care through that March date. So you should reach out to your provider as soon as possible. I know that a couple people mentioned that in the chat that their provider had already stopped care. A lot of providers, that is their situation. So again, reach out to them so they can let you know what their plan is for the next 6 months, and reach out to us and we can help you figure out some next steps if you have to find care outside of the state. Again, I'm going to stay general here, but for your specific situations, we will help you figure out an answer. But for families in Eastern and Central Tennessee for whom traveling to North Carolina to continue care feels like the best option, we encourage you to reach out to us as soon as possible so we can direct you to a clinic. Because in North Carolina, there will likely be an August 1st deadline to begin a new course of treatment. We have clinics who are able to prioritize getting families into care before August 1st. I know that feels really soon, but this deadline should be top of mind if North Carolina feels like the state closest to you. For example, if your child is currently on blockers and looking to start hormone therapy soon, or has not started blockers yet, but is planning to ASAP. If the young person in your life has already started HRT, this August 1st deadline is not relevant, but I do want everyone to keep that kind of date in mind. If North Carolina feels like the best option, please reach out to us as quickly as possible and we will help get you into a clinic. Again, we're also ready to provide personalized patient navigation services to anyone who might need it right now as you figure out your best options. But I'm going to hand it over to Molly to share some resources available to families in the western part of Tennessee with insight about Arkansas and Illinois.
Thank you so much, Carolyn. And it's really great to know, I want to lift up the program that we run here in Memphis. We've definitely heard from many West Tennessee youth who've benefited from the Southern Trans Youth Emergency Program and the ability to call and ask those questions and get emergency support. So we really do, support and endorse that amazing program. So I want to share with you a little bit about resources here in West Tennessee, and I'm actually going to start with OUTMemphis. So OUTMemphis is a full-service LGBTQ community center, social service provider. We're located across Memphis. We have 3 locations, And for youth that are impacted in particular from the ban, we run the most incredible, amazing program that's called PRISM, which is a community group and resource program for queer identified youth between the ages of 12 and 17. PRISM has a series of aspects to it. First being that it is a really fabulous youth group. The youth group for those within driving distance meets on Saturdays, most Saturdays, although I will say that in July, we're taking a little bit of a break. So please check our schedule. Most Saturdays from 1 p.m. to 3 p.m. At our Midtown Community Center. And it is an opportunity to get a range of different kinds of experiences. Sometimes our youth group will have folks who are simply coming to hang out and decorate cupcakes or do art projects or play video games or watch movies. Other times we'll have therapists come in and facilitate conversations, or other local experts or more detailed or specific activities. Last week we went to an escape room, which was a blast. We do rock climbing, we do all kinds of different things depending on the week. The other amazing resource that I want to lift up as part of PRISM tonight is our online resource, which we use through this app that's called Remind. So there is an online group for PRISM. So for those of you who are either 12 to 17 or you are a caregiver of a 12 to 17-year-old, you can subscribe to our group chat. So even if you're not a Memphian or you don't have driving distance to Memphis, or you're not interested in coming to the youth group, in that group chat, we post every update that we have. So as soon as the bill went into effect after the Sixth Circuit ruling, we immediately sent out information to that chat with as much as we knew and places to access information. We also put programming announcements there. So if you want to join our group chat, you text at symbol out OUT 892. You text that to 81010. I'll drop that into the chat after when I pass to the next person, because I can't multitask. But it's an amazing way just to stay in touch. And if you're shy and you're not sure it's the right thing to do, you can subscribe and just watch the other chats and announcements come through before you decide if you really want to be a part of it. I want to, talk a little bit about moving forward. So in addition to our youth group, we also will be providing, starting in August, so just in a couple of weeks, we're going to be providing case management and more direct care navigation for any LGBTQ youth 12 to 17, regardless of what you're seeking. So I know that there are many trans and gender nonconforming youth who maybe are still figuring out what role gender affirming care plays in your life, but perhaps you're seeking information about mental health or shapewear or social transition or relationships or how to talk to your parents. And our case management program will provide all of that amazing care within the umbrella of what we do. That's going to be available to West Tennessee residents, in addition to North Mississippi and some Arkansas residents as well. So please look out for that information. It's an amazing new branch of our program called PRISM Care Navigation. So that's PRISM, and happy to answer more questions about it. The director of our program, PRISM, is on a much-deserved vacation, but their name is Anu Iyer. If you haven't met them, they were at our last town hall. You can reach out to them at any time that you want to ask questions about the services that we provide. All right, so I also want to talk a little bit about out-of-state care for West Tennessee folks. As Carolyn said, North Carolina is a really solid option, and our recommendation, based on a ton of research and relationships that we've been building over the last couple of months, is to start by looking at options in Illinois. We actually very lucky to have one of our Illinois providers here on the call who's going to talk to you in a few minutes. But we have worked over the past few months to put together a series of gender-affirming care providers in Illinois, all of whom are driving distance, some closer to others, to both Memphis, Nashville, and everybody in between. Depending on need, we do have access to a provider who is taking patients that does blockers, that does youth under 16. We have those whose providers that start at 16, a couple of different options. We have access to a couple of providers that have financial assistance, navigation services, case management. And you're going to hear in a few minutes from our friends at Choices who are going to talk about their clinic in Carbondale. But I also want to mention to all of you tonight that part of our mission and our muscle over the last couple of months has been building relationships with other social services and community organizations throughout Illinois, so that if you are a person or a family who is going to navigate your gender-affirming care to Illinois and still want to, and hopefully will continue to live in Tennessee, there are so many people in Illinois who are ready to help you, to hang out with you, to have coffee with you before your appointment. There are community centers that you can drop into to meet people in Illinois. There are folks across Southern Illinois and up to Chicago who are standing by our Tennessee youth and are so ready and so willing and passionate to meet you where you are and to support you and your family during this time. And we're really excited about those relationships. Our mission and our goal is to make the world right now a little bit smaller. And if driving long distances is going to be a part of a lot of y'all's lives moving forward, we want to make that as easy as possible. What did I miss? Okay, I want to talk for a second about Arkansas. So recently, the Arkansas litigation finally came to a conclusion, and the ban on gender-affirming care for minors was struck down in Arkansas maybe like 3 weeks ago. That timing's probably wrong, but 3-ish weeks ago, which is a huge court victory and hopefully a good sign for what comes next. So as of today, gender-affirming care for minors is legal in Arkansas. Unfortunately, because we were looking at over 2 years of litigation in Arkansas, there are not many providers anymore in Arkansas who are currently serving. There is one provider in Northwest Arkansas, which I know for East Tennessee people on the call is like not relevant at all, but for my Memphis people, there is someone there that we're trying to find a little bit more information on. And we are also working with a couple of different folks to figure out what's going to open in Arkansas, what will be accessible on what kind of timelines. So I know that's a little bit of a non-update update, but I felt it was important to talk about tonight. And for those of you who are in Memphis, if Arkansas is in your future for gender-affirming care, there's also some really, really incredible social organizations in and around Little Rock that are helping to figure out the navigation to care options and social support in Arkansas. And we really, really look forward to, building that network as well. Okay, I'm trying to think if there's anything I forgot. I'm happy to jump into questions a little bit later. So without any further ado, I am going to pass over. I mentioned that I teased that we have one of our Illinois providers on the call today. So it's my pleasure to pass it over to Jennifer Pepper with Choices.
Hey, y'all. It's a pleasure to be here with y'all today and to continue to support our LGBTQ+ communities in any way we can. Choices is continuing to provide gender-affirming care in our Memphis clinic for all of the folks that are already in care with us, and we will continue to see them until the March 2024 deadline. For folks that are not in care with us in Memphis currently, or perhaps don't feel safe continuing their care in Tennessee, our brand new clinic that we opened in Carbondale, Illinois, is also providing gender-affirming care. for folks 16 and above. And Illinois law does require us to have parental permission. We are providing hormone therapy primarily, and links and referrals, and have a network of LGBTQ affirming and focused nonprofits throughout Southern Illinois that Molly mentioned. The Rainbow Cafe is a wonderful LGBTQ community center that is in Carbondale, has been there for many decades, and has been a great partner for us. And so we are just pleased to be able to continue care for our trans brothers and sisters and family members, just the same way we're providing abortion care, continuing to provide abortion care in Carbondale. So Carbondale is about 3 hours by car from both Memphis and Nashville. There's not a lot on the way there, but it is a darling community and is very accepting and friendly and wants to be the blue dot in Southern Illinois to take care of folks. In fact, their city council just last week unanimously passed an ordinance declaring themselves a haven for bodily autonomy. So for both abortion access, but also gender affirming care access. So Choice is incredibly proud to be part of the Carbondale community. And we also, like the other folks have mentioned, we have access both internally to patient assistance to cover the financial cost of care, but also with our good friends at the Southern Campaign for Equality have provided some support for that. And so the cost of care should not be a problem for folks coming to us. We can support you through that and figure that out for everybody. And so Choice is glad to be in this with everybody. Thanks y'all for having me, and I'm happy to stick around and answer any questions. If folks are interested, please, you can call any of our phone numbers. Our Memphis number is the one I know by heart. I'll drop it in the chat, and we'll get you to somebody to talk about making an appointment, what that looks like, and any financial assistance that you may have needs for. So thank y'all so much.
Thank you so much, Jen. All right, I'm going to pass it over to Allie Chapman with the Tennessee Equality Project.
Hi, everyone. My name is Allie Chapman. My pronouns are she, her. I'm with the Tennessee Equality Project. I'm located in Knoxville, and I'm also the parent of a trans person who is now an adult that received gender-affirming care in the state of Tennessee, including surgically as a minor. So I have quite a bit of experience as a parent, and I've now been doing this for 8 years as an advocate. And I've been watching what's happening. And with Tennessee Equality Project, you know, what we do is we're solely focused on legislative advocacy and policy work, and working at local and state levels with our elected officials. And in that capacity, what we're doing is also sort of kind of a clearinghouse, but also working in different coalitions to work together to combat the legislation that's happening every step of the way. And we do that we do legislative advocacy trainings, we do different events like postcard writing. We have some new programming that's upcoming that we're preparing for January. And we have this, I guess we have August special session as kind of our test case to really get people involved and learn how the process works. Some of the things that I did, you know, that I know people have on their mind, and I've spoken about it in other places, is with the Attorney General and Vanderbilt University Medical Center. And I want to specifically address that here, because I think that it's important for people to recognize this actually has far-reaching effects for everybody and their comfort level and their trust with healthcare providers, hospitals, and other healthcare just professionals in general. So this is, you know, this isn't just Vanderbilt, this isn't just trans kids and families, this goes way beyond that. And I think that, you know, something I keep talking about is the real work at this point. The onus, unfortunately, is on healthcare providers and hospitals to really secure confidentiality, to rebuild and build trust with patients again. I think that this has the potential to really have negative impacts on health outcomes, both short and long term. People will start avoiding getting healthcare at all, or not being fully honest in the exam room, or because they can't have care, they're going to be then, as we all know here, kids entering into the wrong puberty and then having lifelong consequences from that. So those outside of the community who care for, love, or are a part of trans families really don't understand the gravity of what that situation was, the violation of trust. So, you know, something I want to also elevate is we're watching laws that the past, but we're also watching the bills that were delayed to January because they're still in play. And there are a few that I'm really paying attention to. One is the TennCare bill. That one we think will be an avenue to impact adult gender affirming care in the state of Tennessee. So we're watching that one. The binary gender marker law that passed that's led to a lot of confusion. It is unclear, and we're watching the rulemaking process on that because right now, as it's written, it does not impact name changes. So there's been some confusion about that. But we've also heard some cases where in, I think, Williamson County, there was one person who was refused the gender marker change on their driver's license, and the clerk cited the law as the reason for that. So we have all kinds of things you can get involved with, and I'm going to drop that in the chat. Lastly, I was privileged to be a part of a meeting with the Department of Justice, Health and Human Services, and their Office of Civil Rights, and received instructions specifically for families who were impacted either by the law or were victims of the VUMC and the Attorney General Skermetti's capture of private health information. So I'm going to put those in the chat as well, but we would, we're referring people to both ACLU Tennessee and the Health and Human Services Office of Civil Rights to file complaints on those specific issues. And like I said, then I'll add information on here as well, so you can link up with Tennessee Equality Project and get involved locally and at the state level, both at home, and you can come with us to Nashville. And we work closely with all the partners here on this call, and we couldn't do it without everybody here. Thanks.
Allie, thank you so much. And thank you so much for all of the legislative warriors that we've got in Nashville and across the state from TEP. All right, so we are going to jump into our Q&A because I know there are approximately 5,000 questions, which is great. So as I said when we started, we're not going to get to every single question, but we are going to conclude tonight by making sure that you know how to seek the answer that you need, the best person to ask, the best place to look for information. Okay, so there's really two ways that we're going to do this Q&A. I'm going to take questions both from anybody that feels